Hello, everybody. Welcome to today's OET live lesson. My name is Jo. Nice to have you here. Please do say hello in the chat. Let me know where you are in the world. And is anyone taking their OET test soon? Let me know. We love to hear from you and what you're up to. Okay, so today we're going to be looking at writing a successful referral letter. I'm just going to share my screen. So just first of all, I'd just like to tell you a little bit about SLC. So I'm Jo from Specialist Language Courses. You may know us as SLC. So we provide subscriptions to our digital online courses as well as OET tuition. So please do go and check out our website, specialistlanguagecourses.com. We have subscription packages. So that's 1 or 3 month subscription packages. And this is Reach OETB nursing. And we also have one for medicine. It includes 100 hours of preparation. You've got 4 live lessons a week with a teacher. It includes 3 full OET practice tests, 70 video tutorials, 5 writing correction letters to view, and the SLC Progress Promise. Now, this means that you can attend our live lessons 4 days a week until you pass your test. So that is our Progress Promise for you. So please do go and check us out on specialistlanguagecourses.com. We also have packages that can be done in combination with tuition as well with one of our expert tutors. We have a discount code for those courses. So stay until the end of today's session and we'll send you our discount code. So please do stay to the end and you can get that discount code for our course. So if you're not already following us on YouTube, we've got loads of tips and strategies videos on there. We've got a new season coming up in the new year, but we've got 5 seasons so far on there. So please do go and check us out. Right, let's get talking about OET writing. So I have got some sentences here and I would like you to let me know which of these sentences are true. So write the numbers of the true sentences in the comments, please. So you'll always write a letter, you'll write as your profession, you will always write a referral letter, and you should not include everything on the case notes. All case notes contain the same information. So I'll give you a minute to let me know. Okay. Okay, so let's take a little look at the answers together. So yes, you always write a letter. That is always true. No matter what your profession, it's always a letter. And you will always write as your profession. So if you're a doctor, you'll write as a doctor. If you're a nurse, you'll write as a nurse. If you're a pharmacist, as a pharmacist. You may be a different type of doctor or nurse. You could be a GP, you could be a hospital doctor, you might be a community nurse, hospital nurse. You know, those can vary, but you will be a nurse or a doctor or a pharmacist or whoever you are. It's not always a referral letter. It could be a discharge letter, transfer letter. So for medicine and nursing, correct. You should not include everything on the case notes, only what's relevant to the purpose of the letter. And this is very important. And all case notes contain the same information? No, which is why you have to approach every set of case notes differently. Okay, so what you include depends on what the purpose of the letter is. You need to look at the case notes and decide what to include. So we're talking about referral letters today. So let me know, who might you write a referral letter to? What could be some possibilities? Let me know in the comments. There's quite a few different people that you might write to? All right, let's take a look at some examples. So we've got doctor or nurse, specialist maybe, physiotherapist, occupational therapist. So you could write to one of the other healthcare professionals. And why might you write a referral letter? Any ideas? Let me know in the comments. I mean, there's lots of different reasons. In terms of overall purpose, you might maybe request further management or monitoring, ongoing care, something like that. Maybe confirmation of a diagnosis. This happens in medicine sometimes, or perhaps further assessment. Those are just a few of the reasons why you might write a letter. Where can you find this information? You can find this information down the bottom of the letter in the task. So we'll take a look at that in a little bit. So let's look at understanding and analyzing the case notes. So important. You can't write an effective referral letter if you don't understand the case notes or know how to analyze them effectively. So here are my top tips. So first, who is your reader? Why are you writing? Get that clear. What is the main focus of the letter? And specifically, what are you requesting the reader to do? And then, based on those three things, what information does the reader need in order to carry out the action required? So, you're requesting something. What do they need so that they can carry out that request? And also, bearing in mind what information the reader already knows or doesn't need to know. So maybe cross that out once the reading time is over and you're allowed to pick up your pen or pencil. So here are the steps involved in writing a referral letter. So look at the case notes, who you're writing to and why, decide what information's relevant and what information they don't need. Then, very important to make a plan. Think about a logical way to group information together. You then write your letter using clear language, and then always save a little bit of time to check your letter for errors and make sure you've included the key information. So that's quite important. Try and leave about 5 minutes at the end for checking because it's amazing. You know, as you're writing, you tend to make mistakes. You might have left a few things out that were on your plan. So checking is a really good way to make sure that you've got everything you need in your letter and you've written the best letter you can. So we're going to look at the first two steps here, so analyzing the case notes to make sure that you get a high score for content and conciseness and clarity. So I've got some example case notes here. So we need to look at the reader and the reason for writing. So just by looking at the notes and the writing task, you can find out that information and it's key information. So what we want to know is, who am I? How do I know the patient? So are they attending my clinic? Are they in my ward at the hospital, for example? Who am I writing to and what's their role? Yeah. And is there an existing relationship between the reader and the patient? And why am I writing? What is the main purpose of my letter? So have a quick read through these notes and writing task and see if you can answer these questions. I'll be quiet for a couple of minutes. Okay, so this is a set of medicine case notes, but if you're a nurse, this is still a very valid activity to practice. You still have notes and writing tasks in your case notes. So if we have a little look here, you have been Ms. Bennett's GP for 2 years, and you've been treating her recently following her hospitalization for cardiac problems. So you're her GP, and we've got information about recent hospitalization for cardiac problems. So that's sort of the recent history. Who are you writing to? So you're writing to Dr. Banerjee, who is a consultant cardiologist, and there's no indication of an existing relationship. And why am I writing? Well, to briefly outline Ms. Bennett's history and treatment so far, requesting advice and review of her medication. So we need to briefly outline the history and treatment, and the requests are advice and a review of her medication. So we need to choose the history and treatment that relates to the advice and review of medication that we're requesting. Okay, so really important that you can find out this information before you analyze the case notes. So I have got a another set of case notes. This time it's nursing. So I would like you to let me know in the chat who is the reader and what is the reason for writing. So have a look. Let me know in the comments. Okay. So if we have a little look together now, if you look at the notes. So who is the reader? The reader is the emergency department consultant on duty at Newtown Hospital. So writing a referral to this person. Why? And we've got a few things. A possible relapse or complications of pericarditis. And we need to refer back to the emergency department or to the emergency department, outlining the case and requesting urgent assessment and management for pericarditis. So if we look at the context, we're a nurse visiting the patient at home, routine follow-up care after the patient's recent hospital discharge. So we might need to mention the patient's been in hospital with discharge. However, there's a possible relapse and they need to go back to hospital. So we need to outline relevant information about that so that the reader can carry out their urgent assessment and management. So don't forget to stay to the end of today's session to access our discount code for our Reach OETB online course. Do stay to the end. We'll be giving that soon. Right, let's look at selecting content now. So in order to achieve a high score for content, you have to include all information needed for continued care. And that information needs to be accurate. So let's go back to the pericarditis case. Okay, so if you look at the top, we've got assessment and plan. Okay, now remember we're writing requesting urgent assessment and management. Okay, and we need to outline the case. So what information should you include in this letter out of the assessment and plan? Have a read through that section and think about that. Let me know in the comments. All right. So we need to mention that they're ill, they haven't made improvement, and your assessment, a possible relapse with complications of pericarditis. Now, we don't need to include organize urgent hospital transfer, write a referral letter. That's what you're doing now. But you do need to include details about medications, patient history, and test results and observation. Then you look at the rest of the case notes and decide what information is relevant regarding those three topics. But remember that it's an urgent case, so you want to keep things on current situation and future care needs as much as possible, but you will need to include past medical history relating to those as well. So what should you do if you don't know if you should include a piece of information or not? Because sometimes you're like, well, it might be useful. I don't know. Um, Ask yourself this question. Does the reader need to know this in order to carry out the action you are requesting in the letter? If the answer is in yes, obviously include it. If the answer is no, it's not connected to that action required, don't include it. However, if you've got maybe this information might be useful, just include it. You don't want to spend ages and ages going, oh, shall I include it? Shall I not? Shall I? Shall I not? Just include it. But perhaps if you think it's only useful, don't give it such big prominence in such detail. Okay, moving on to accuracy of content, very important. Here we have got an extract from some case notes where you need to write a letter of referral to a gastroenterologist for assessment of Mr. Knowles. So you've got the last visit, consultation, and then you've got the plan. So I want you to look through the plan and then read the sentences on the right-hand side, 1 to 5, and let me know which sentences are inaccurate. Which ones have been inaccurately represented? Let me know in the comments. Okay, thank you for your ideas. So let's have a little look together. So number 1 is incorrect. You're being absolute here and saying, yes, he has it, whereas the case notes have a question mark. Possible, suspected. 2 is correct. 3 is incorrect. You don't want the reader to urgently refer Mr. Knowles for an assessment endoscopy. You want the reader to do an assessment and endoscopy. You, the writer, are urgently referring Mr. Knowles. So you don't include that in your letter. It's incorrect information. His abdomen is very swollen. No, it's slightly swollen. So do be careful. And number 5 is correct information. So make sure you're not changing things when you write them in your letter, and don't include things that you're doing, like the referral, because this is the referral letter. So it becomes very confusing for the reader. Okay, moving on to avoiding irrelevancies. So you need to make sure you do not include irrelevant information, which they don't need to know. And you need to summarize information concisely and clearly without unnecessary detail which distracts the reader. So make sure that the focus is right. So in the OET exam, you might be asked to write a referral letter to another healthcare profession. And this can affect the information you choose to include. So you want to make sure that you don't include irrelevancies. So first of all, what other healthcare professionals might you write to? Let me know in the comments. Great. Yeah, so I think if you're a doctor, you might write to a nurse. If you're a nurse, you might write to a doctor, for example. Yes. But then other healthcare professionals, maybe occupational therapists, yes, physio, dietitian, perhaps, yes. Possibly speech pathologist. If you're a doctor, that would be a possible one. Uh, the main point is be prepared for anything and make sure that the selection of content is based on reader awareness. That's what you need to demonstrate. So only information relevant to them is needed. For example, an occupational therapist will not need information on medication, and a physiotherapist will only need to know information relating to mobility or physiotherapy sessions rather than information on wound care after operation. They're not involved in wound care. So if you include it, it's distracting from the main purpose of the letter, and you will get marked down for conciseness and clarity. Okay, here is a extract from some case notes. So have a quick read through and let me know, who are you writing to, why, and what kind of information does the reader need in order to carry out these actions? So have a think about those questions. You can let me know in the comments and then we'll go through together. Okay, let's have a little look together then. So, yeah, you're writing to the occupational therapist to request an assessment of the patient's workplace. Okay. You also need to detail the situation. Yes, you do. Yes. So that means the reader would need to know information in his job. So, what is his job? Are there any particular job duties they need to be aware of? What are his current capabilities? So, obviously, they'll need to assess whether his current situation is able to allow him to return to work or fulfill his job duties, or maybe they need to be modified. The injury sustained, they'd probably be interested in that. So when was the back injury, perhaps? And are they using any mobility aids or having any physiotherapy? They might be interested in that as well. So here are two paragraphs for that letter. I would like you to let me know which paragraph only contains relevant information in this letter. Let me know in the chat, please, in the comments. Great. Okay, yes. Paragraph 2. Paragraph 1 has got things about medication that's not necessary, and the fact that he's married with 3 children, it's not relevant. Okay, the final thing we're going to look at is requesting or informing. So in a referral letter, you will be informing them or reporting information. And then some things you'll actually be requesting. So asking the reader to action something. So what kind of information is commonly reported and requested? I'm interested to know your ideas. Let me know in the comments, please. Mhm. Okay. Okay, so I've got a few things here. Now, this is just some. I know we've got other ideas as well. But you might request monitoring, yes, as some of you might say, but we also might report previous monitoring that's already happened. For example, examination results, yes. Further assessment, yes. I mean, test and lab results. Think about which ones would that be requesting or would that be informing? Um, assistance with ADLs, would that be requesting or informing? Some of these could be both, but I would like you to let me know which ones would go with informing and reporting and which ones would go with requesting. Let me know the number letter combinations in the chat. Okay, yeah. So these are what's most likely. Examinations could go in both. I think monitoring could go in both as well. Yes, and test lab results could be go in both. Maybe assistance with ADLs as well. Yeah. But most commonly, they're like this. So now we need to make sure we're using the right phrases. So, for example, reporting an appointment has been arranged, so it's already been done. We're just telling the reader. Whereas it would be appreciated if you could is requesting. What other phrases do you know? Let me know numbers 1 to 4. Do they go with informing A or requesting B? Let me know in the chat, please. All right, that's great. So yes, the most logical ones here is she will attend. So we're not asking the reader to do anything. We're just telling them it will happen. Again, the staples, we're just saying this will happen. The reader doesn't need to remove them. But requesting phrases, These are the good ones to use. It would be appreciated if you could. I would be grateful if you could. And your further management is required, for example. So how do you know if the reader needs to take action? Take a look at these future care plans that are part of a referral letter. So verbs are often included if they require action, but not always. So if we have a little look here, we've got dressings to leg ulcers 3 times per week. Now the reader needs to do this, but there's no verb. But we know that that's what the reader needs to do. And we've got report increased pain or infection to the GP. Monitor hemoglobin levels, blood test once a week. So the monitor, that's telling us that the reader needs to do it. And again, monitor blood glucose level, encourage low sugar diet. That needs to happen. The appointment at the diabetes clinic, the reader doesn't need to take action. It's just there to report. It's like an FYI for your information. This is also happening. It's related, but you don't need to do anything. So let's do a bit of practice. Look at this extract from a set of case notes. Okay, so it comes from a referral to a community nurse, and I would like you to decide which paragraph best describes the action to be taken. So I've got 3 paragraphs here. Look at the case notes. Which one best describes the action to be taken? I'll be quiet for a couple of minutes. Okay, great. Yes, paragraph 2. Okay. In paragraph 1, it's just saying this needs to happen, this needs to happen. So it's not clear that you actually want the reader to do it. Paragraph 3, there's just too much in terms of requesting phrase. You don't want to do a formal request phrase in every single sentence. It's just too much. So paragraph 2 is much clearer for the reader. Okay, so one last little activity. Let's see what you remember in terms of requesting and informing. I have got some phrases that you might include in a referral letter. I would like, oops, for example, here we've got, if you could monitor his wound and apply daily dressings. What phrase could you put here? You would put, I would appreciate it if. Okay, this is a good example. What about number 2? What word or phrase could you put for number 2? Okay. So you want to tell them that it's already organized. So yeah, has been arranged, has been scheduled. Yes, is booked for also. I'd use present perfect here because it happened in the past, but it's got, it relates to the present future. Okay, and what about number 3? Okay. Would be appreciated is a good one. And finally, number 4. Okay. Kindly please monitor is, you wouldn't do kindly and please, you would just say kindly monitor, but could you please is a good phrase to use. Okay, so my top tips: find out who you're writing to and why first. Be clear on the main focus of the letter. Select information the reader needs to know according to the purpose of the letter. Make sure this information is accurate and be clear about what you're requesting and what you're reporting, and use appropriate language for those functions. So that's it. You're at the end of today's session. That means you can have your discount code for our Reach OETB nursing and medicine courses. So you got the QR code on the screen there, or you can just go to our website, specialistlanguagecourses.com/OET-preparation. It's there on the bottom of the screen, or just look for us by finding specialist language courses and go to OET Prep. And the code is autumn_sale. And if you use that code, you will get 10% off your subscription package. So do go and check us out. Thanks so much for coming today. If you're not already following us on the usual social medias, please do. We're always posting things that can help you in your OET preparation. And I look forward to seeing you in the next live lesson. Good luck, anyone doing your test. Thanks so much for joining me today. Bye-bye.